Hello, medical terminology students. This week, our first week, we will be reviewing chapter 1 in your book. And this video just goes over some of the things that you're going to learn about in chapter 1. So let's begin. Chapter 1, titled The Anatomy of Medical Terms. This is where you're going to learn the different components of the medical terms and what what they are, some of the meanings of the medical terms, how you break a medical term down or build it back up. So let's begin here. If you look in your book on page 10, this is going to be your ebook. This is where it all starts. We learn about roots or root words and combining forms. So there are three different components of medical terminology. The first one is referred to as roots or root words. The second one is a prefix, and the third is a suffix. So if you look on here, the root word is actually the core meaning of the word. The prefix are going to be the part of the word that comes at the beginning of some of the words. Suffix is the part of the word that comes at the end of some of the words. If you go back to elementary school, we learned a lot about prefixes in the beginning of words to describe them, and suffixes, the ending of words to describe the word. The definition of a combining vowel is going to be a vowel that joins a root word to either another root word or to a suffix. And right now, this probably doesn't make a lot of sense, but it will. The combining form is the combination of a root word and a combining vowel. So in your book on page 10, you will see combining forms. You will see the example of pneum, P-N-E-U-M with a dash. That's a root word. That means lung or air. The combining vowel is an O. So when you combine pneum, P-N-E-U-M, with an O at the end of that, that forms the combining form. So when you actually, let's say you're going to see, pneumonia. Pneumonia is a total word. So pneum, P-N-E-U-M, is actually the root word. They're going to add an O to that, and really pneumonia means a condition of the lungs. There's another example about pulmon and pulmono. You can look in your textbook. Let's continue on. Oh, these are some root words. So the root word, it's constant, it's unchanging. It provides the basic meaning of that medical term. And yes, you can have more than one root word in a medical term. Up here also says that nearly all medical terms are going to have one or more root words, and they can appear anywhere in the term. They can appear in the beginning without a prefix. They can appear at the end without a suffix. They can appear in the middle. So here are some examples of root words. We have pneum and pneumon, pulmon, hem, or heme. Sometimes it's pronounced heme. And then bronch. Combining vowels. Like I stated, that combining vowel is where you have to add another vowel, A, E, I, or U, in between a root word or another root word or a root word and a suffix. And all it does is it makes it easier to pronounce. It doesn't change the meaning or the definition at all. The most common combining vowel is going to be an O, followed by an A. Sometimes you will see an I, sometimes you will see an E in there. There may be a U. I don't know that I've ever seen a U, but it is possible. So if you look on that page 10 again, towards the bottom, right before the checkpoint, you'll see where it actually breaks down the word hemopneumothorax. So hem means blood, pneum means lung or air, thorax is the suffix, and that means chest. If I were to say hem, pneum, thorax, doesn't sound very well. So, or it's hard to pronounce. So when I add those combining vowels in there, hemopneumothorax, it's just easier to pronounce, is all it is. Here's again more combining forms. A combining form is actually the root word with a combining vowel. That's all it is. It can precede a suffix, and here are some examples. You can look these up in your book. So when we look at gastroenterology, this here has root words. It has a suffix, and then it has the combining vowel. So if you look at gastro, that's an actual root word. The combining vowel, it's actually a combining form because the combining vowel is the O. Enter is the root word, O is the combining vowel, and logi is the suffix. And when you put it all together, it means the study of the stomach and intestines. So now we go on to gynecologist and cardiologist. Breaking them down, you can see for gynecologist, the gynec is the root word, the O is the combining vowel, the logist is the suffix, and this means a specialist or one who studies or specializes in the female body. And then we have cardiology. So cardio is the combining form. Cardio would be the root word. O is the combining vowel. You put the two together, you have cardio, and logi means the study of, so cardiology. Suffixes. So we already talked about root words and combining forms, which as time goes on, this will make more sense. It's just chapter 1, so be mindful. It'll get better. So the suffix is always going to end at the end. And you can see some examples at the bottom. We have hematoma. The hemat is the root word. The suffix is the oma in that one. Hematologist, the hemato is the combining form. The logist is the suffix. So again, there's lots of suffixes on page 11 of your textbook. You will see quite a few suffixes, and it's just going to take memorization to remember them all. There are classification of suffixes, and the idea is that you just create your flashcards to remember these ones. There are diagnostic suffixes, there's surgical suffixes, pathological suffixes, descriptive or adjectival suffixes, and then noun suffixes. And in your book, you'll be able to see the differences of those suffixes within their category. Here's an example of diagnostic suffixes where we're diagnosing a condition, or at least the provider's diagnosing a condition. And we have hematoma and hematuria. And then we have surgical suffixes. These are actual surgeries, surgical procedures that would be done within a condition. We have appendectomy and lithotripsy. Now we go into pathological suffixes, which has to do with the pathology. And the first one we have cystitis. And then we have cyanosis. Adjectival suffixes, again, these are pretty small where they're just going to give more meaning to the root word as well. So we have cardiac, ac means pertaining to. Pulmonary, airy means pertaining to. And then posterior, IOR, means pertaining to. So cardiac, pertaining to the heart. Pulmonary, pertaining to the lungs. Posterior, pertaining to the back of the body. Noun suffixes, these are some examples: psychiatry, pediatrician, and ossicle. So iatry is the treatment or medical specialty of psych, and psych means mind. Pediatrician, so ishin is this expert specialist in children. And ossicle is a small, minute opening. So now we go on to prefixes. Prefixes start on page 12 of your book. Prefixes always come at the beginning, and you can have a prefix, you may not have a prefix in your words. There's several different prefixes. You can see them in your textbook. So there are classification of prefixes. We have position, number of measurement, and direction. And here's some examples, like anti means against, epi above, hypo below, bi means to, u means normal, micro means small, ab is away from, ad is towards, and post is behind. So here's some examples of positional prefixes. You can see that we have epidermis, and epi means above. So this means above the dermis. And then we have hypodermis. Hypo is prefix, and that means below, and that means below the dermis. Some number and measurement prefixes, multipara and primipara. So multipara means many pregnancies, and primipara means the primary or the first pregnancy. Directional prefixes, we have antivert, and then we have synapse. Can you find the definitions of those prefixes? Well, take a look in your book and see if you can find the definition of what anti means and what syn means. So now we have a review. Let's take a look at this word, hypogastric. What do we have? What word components do we have in here? Well, we have all word components. We have a prefix, we have a root word, and we have a suffix. So the prefix hypo means below, gaster means stomach, and ick is, sorry about that, is the suffix. Ick means pertaining to, below the stomach. And that's how we read it. We start at the end and then read to the beginning. In medical terminology, though, there are some words that you simply just have to memorize. They have no way to break them down. They simply have a meaning, and you just have to memorize the definition. You will see examples of these unique medical words on page 13 of your book. And here are just some examples of these unique words where you just literally need to memorize them. So toxin meaning poison, medical meaning to heal, record meaning to remember. And then we have some terms that are alike, where you'll have to identify the differences. You can see the spelling are different. So we have ilium and ilium. Those are two different things. And malleus and malleolus, which are two different things in the body. So, hey, take a look in your book and see if you can identify what an ilium is in comparison to an ilium, and what a malleus is in comparison to a malleolus. Some review here. So let's take a look at this review. This is just for your fun. You can see that I've separated the prefixes, the root words, and the suffixes based on their color, because that's the color that they are identified in your book. However, in your book, I will tell you that root words, they look more purple than they do pink. So if you see purple or pink, it's going to be the same. It's going to be a root word. So your prefixes are going to be identified in green. Your root words or combining forms are going to be identified in pink or purple. And then your suffixes are going to be identified in blue. So take a look at these. You might want to use this review to learn to, break them down and figure out what each meaning is. And then a little bit more review here. So the idea is to match them up. To see, Noom does not mean to breathe. So Noom, you would find what it means actually over here and then just match it up. So again, just more review for you guys to do if you want to. Here are a couple of questions that if you want to do. So one who studies the skin, is it 1, 2, or 3? The study of intestines and the stomach, is it 1, 2, or 3? Related to the process of breathing, is it 1, 2, or 3? Inflammation of the stomach, is it 1, 2, or 3? Inflammation of the joint, 1, 2, or 3? And the study of the urinary system, is it 1, 2, or 3? That concludes chapter 1. Again, please don't feel overwhelmed if you're still not getting it. It will make sense. Trust me, it'll make sense. Let me know if you guys have any questions.